My name is Diana Donito, and I'm a professor at the School of Social Work at the University of Texas at Austin. The video that you're viewing is designed to introduce you to motivational interviewing and to demonstrate its use with an older adult who is drinking at a risk level. Risk drinking is drinking that exceeds recommended limits for a person based on their age and health status. The project that you're looking at is part of a larger project to educate social workers and other health professionals about working with older adults who have substance use problems, health problems, and mental health problems. The project is sponsored by the John A. Hartford Foundation, the Council on Social Work Education, and the Council's Gero Ed Center. Our video today is divided into 3 parts. In the first part, we'll be talking a little bit about what motivational interviewing is. In the second part, we'll have a demonstration interview of motivational interviewing with an older adult client. In the third part of our video, we'll have a debriefing of the interview. With me are Mary Velasquez and Nanette Stevens. Dr. Velasquez is a professor in the School of Social Work at the University of Texas at Austin. She's the Associate Dean for Research, and she's the Director of the Center for Social Work Research and the Health Behavior Research and Training Institute. Dr. Stevens is a research scientist at the School of Social Work, and she is the Director of Training at the Health Behavior Research and Training Institute. Both are experts in motivational interviewing, and they have done extensive research and training on motivational interviewing to help people with substance use and other health behavior problems. Let me start by asking Dr. Velasquez to talk a little bit about what motivational interviewing is and who developed it.
Well, Diana, motivational interviewing is a counseling style that was developed by 2 psychologists, William Miller and Stephen Rolnick. And motivational interviewing is a counseling style, again, that's designed to elicit a person's own motivation for change. And so in motivational interviewing, rather than telling the client what to do or giving advice, we're really trying to draw from the client his or her own reasons for change and build on that motivation.
Good. Tell us a little bit about the spirit and strategies of motivational interviewing.
Yeah. Well, the spirit of motivational interviewing can be somewhat different from a lot of other therapies in that it really focuses on, we use the acronym ACE, A-C-E. There are a lot of acronyms in motivational interviewing to help us remember. And A is for autonomy, and that's basically where we're respecting the client's right to decide whether to change or not. We always let the client know that the decision for change is completely up to them. We're not going to pressure them. We're not going to require that they do anything they don't want to do. So that's the autonomy piece. The next piece is collaboration, and in motivational interviewing there's a very respectful, rapport-building style. The relationship is one where it's a collaboration. It's not a one up, one down, or expert, not expert, or doctor-patient relationship as much as it is a collaborative effort. And then the third is evocation. And in motivational interviewing, the idea is that the therapist evokes from the client or elicits from the client his or her, again, own reasons for change. So rather than offering advice, rather than directing the session, although there is some advice giving potentially, and there's some direction, we'll talk about that later, but basically we're trying to get the client to talk about their own reasons for change.
The eliciting is really listening and eliciting the client's strengths, their goals, and particularly their values that drive some of their decisions.
Good. So it focuses on the client's strengths. Mm-hmm. And Nanette, why do you like using motivational interviewing?
What makes motivational interviewing a good fit for many of us is it's empathic, non-confrontational in the traditional sense style. It's a very respectful style that is based on perhaps leaving expectations aside and going into the encounter with a curiosity and an interest, which requires listening, and understanding the person's story, their goals, their values, what they would like in their life.
Good. And tell us a little bit about why you think motivational interviewing might be particularly helpful for an older adult and an older adult with a substance use problem.
Well, I think it's foundational elements based on Empathy, which is an understanding of another person's perspective and world, sets the stage for an encounter that's genuine with an older person. Again, that's based on listening and curiosity rather than expecting that person will be one way or another. It's a very respectful approach, as Mary said, respectful of the client's autonomy, of their personhood, of their strengths, and the combination of that respect and empathy, I think, is a wonderful fit for older individuals as well as all individuals.
It certainly sounds like it. And Mary, would you tell us, what does it take in terms of training to become a qualified motivational interviewing therapist?
Motivational interviewing is it requires skill, and it's also an art in a lot of ways. Typically, for people to be trained well in motivational interviewing, they would attend some initial workshops and learn about motivational interviewing, but there are a lot of different sort of steps to grow toward proficiency. And in fact, Dr. Miller describes 8 steps in learning motivational interviewing. But essentially, a person would probably attend some training workshops, and then in the best case scenario, they would go back to their setting and they would begin to practice their skills, and then they would get perhaps some coaching from someone who is an expert or a trainer in motivational interviewing. So for example, in our programs, oftentimes a person will attend the workshop and then they're assigned an expert coach, such as Nanette. So it's not something you can just have, one session or one exposure to and learn it easily. In fact, there have been some studies. Dr. Miller's group did a very interesting study where people received just motivational interviewing training. In another condition, they received training and some feedback in addition to the training. And a third condition, they received training, the feedback, and then some interactive coaching. And the third condition was more successful. So basically, it's a process. And you mentioned the word therapist, and in a lot of cases, other folks besides therapists have been trained and do a good job in motivational interviewing. Physicians, for example, often use a brief style of motivational interviewing, nurses, other healthcare providers. So a lot of people besides the traditional, social worker, psychologist, or therapist. And I guess I also want to add that for social workers, so often it's a very good fit because it's a strength-based, healthy, holistic style of counseling that many social workers find to be a good fit with their social work training.
Yes, it does seem very consistent with the principles that we learn as social workers in social work practice. Let me ask you one other question about treatment fidelity. You mentioned some ways that people can be sure that they're using motivational interviewing in the appropriate way. Are there any other comments that either of you would like to make about assessing treatment fidelity so that people that are using the technique know that they're using it appropriately?
A couple of ways. One is to have, again, experts in MI viewing sessions, and then there's several coding schemes. One is called the MIghty.
It's the Motivational Interviewing Treatment Integrity Coding System.
And it's something that the one who is listening, the expert is listening for certain sorts of MI elements in a session, which we'll talk more about later, but some of the specific skills. And it's a way of almost quantifying how much MI is in the session. And then there's some global scores that are more of an impressionistic, looking for that spirit of MI. So it's a very effective way of kind of monitoring and evaluating how MI is the session or not.
Good. And it does emphasize the evidence base for this type of approach to counseling.
Yes.
Okay, good.
And in fact, speaking of evidence, there are a large number of randomized clinical trials that have been used to explore motivational interviewing, look at its efficacy compared to other conditions, and it's actually very evidence-based. So that's another strong, I think, point that should be made. There are several skills in motivational interviewing, and the acronym we use for that is the OARS. And Nanette, maybe you could talk about the...
Right, the OARS, OARS, and the O stands for open questions, and we favor open questions over closed questions for a number of reasons, but A couple stand out. Particularly, it allows the client to be more engaged, to participate more in the session. It really elicits more client talking and responses, and also it's very helpful in terms of gaining richer information, as opposed to a closed question, which can be answered, with a yes or no or very brief answers. So, we really look for more open questions than closed questions for the richness of the information and for the client participation. And the A, Mary?
Well, the A is for, we can tag team this.
We can tag team.
The A is for affirming. And in motivational interviewing, affirming it's not exactly just simply bestowing praise on a person, but it's really recognizing something in the client's behavior and remarking on that in a positive way. In fact, Nanette warns against, what is it, promiscuous affirmations. So it's really a strategy or skill to be used judiciously. But when a client is making a positive change, and that could be just that not that we're judging their particular change, but maybe just the fact that they showed up that day, but just something that lets the client know that the counselor is recognizing that.
Right. So it sounds like authenticity is really a key
Exactly.
element.
Yeah.
And that's the reason for the cautionary note about promiscuous affirmations. When they're too frequent, given too generally, it almost cheapens them. It dilutes them of the power and the genuineness, really. So we're selective.
Okay. And then the next is reflective listening. And reflective listening is really a very fundamental skill in motivational interviewing. And it's really listening very closely to the client, reflecting what the client says, and doing it in a way, in a very skillful or strategic way. And when I said earlier that motivational interviewing, I mentioned the word directive. And it is directive in a certain way. It's very client-centered, but it's guiding, perhaps even more than directive. And the counselor picks very carefully, very incisively, when to intervene, when to reflect, what to reflect. And so it's, and reflections are at different levels. So there are some simple reflections where the person may be just repeating a few words that the client says. And then there are more complex reflections. It could be a rephrasing, or perhaps then a metaphor, using a metaphor, reflecting the client's feelings, and double-sided reflecting, reflecting both sides of ambivalence, which is important in motivational interviewing. And so it's really it's sort of like the Rogerian therapy that was, simply the good reflective listening, client-centered approach, but it's much more than that as well. It's a very, again, reflective listening is used very strategically. Mm-hmm. Is there anything else you want to mention about?
Well, I think about the purposes of it and the importance in motivational interviewing of empathy. And often when we're doing trainings, we ask, how do you express empathy? How do you let the other person know that you're understanding what they're saying, what they're feeling? And reflections are a prime way of doing that. Nonverbals are another way. But reflections allow you to capture elements of what the client is saying that indicates you're listening carefully, you're interested. And then, as Mary said, they're highly selective, though. You don't reflect everything. Reflect certain things that appear very helpful for the client to hear again, to hear their own words, their own wisdoms, their own strengths again, to hear that you're offering it back to them with this thing called reflective listening.
Good.
And there's a component we'll talk about in a minute that's called change talk. And very often when we hear a client begin to talk about change, that's also what we want to reflect. So when Annette says it's used, again, very strategically, we're looking for certain types of talk, types of language from the client, and we want to be sure we're certain that we reflect when we hear that.
That we're offering it back.
Exactly.
Yeah. And then summaries would be the last, OARS. And summaries, again, are used selectively in motivational interviewing. People who are just beginning to learn motivational interviewing often try to summarize everything. But we pick out certain elements, again, certain responses that the client is given that's helpful for them to hear again. Summaries are wonderful to use. We really recommend that every session ends with a summary of the important things that occurred in that session. But summaries can also be used as a transitional way of moving through a particular session. So it can be a primary skill. And as Bill Miller says, if you ever get stuck, you can use a summary, and then that helps you move to the next area of discussion.
Good point.
And then the other component that it's important to mention is this change talk. And while that's not a skill so much, change talk is something that we hear from a client. And again, there's an acronym that helps us remember that, and that acronym is DARN, D-A-R-N. And so when we hear from a client, as a client moves toward change, they often begin to give voice to the desire to change. So that's the D part. You begin to hear statements about, gee, I'd like to do this. I'd like to make this change. The A is ability to change. I think I can do this. I've done it before. R is reasons. My family gets really upset about this. I really want to be a good spouse. I don't want to lose my job. Reasons for change. And then the need to change. So that's the acronym DARN. So this change talk again is something that a very skilled motivational interviewing sort of person provider sort of tunes their ears and listens carefully for the change talk, and that's when they use the skills, the reflection, open questions. They use a lot of open-ended questions to elicit change talk, and then when they hear the change talk, that's when they reflect. Then in a more major summary, they want to reflect the change talk. So what happens is the client hears when they provide change talk, when they give voice to ideas about change, reasons for change, need for change, ability. They hear it when they say it. They hear it again when the counselor reflects it. And then in the summary that Nanette described, they hear it again. So that change talk is out there 3 different times.
Mary, do you want to talk a little bit about the role of ambivalence? I'm thinking with change talk and in the earlier stages of readiness, there's often so much more ambivalence and maybe less change talk. And as the readiness to change moves, there tends to be an increase in change talk.
Yeah. The concept of ambivalence is also very important, as you know, in motivational interviewing. And the idea here is that it's really in a lot of ways, the discrepancy or the tension or the difference, if you will, between a person's goal for their lives, perhaps, or what they value and their current behavior. And I'm going like this with my hands, because in motivational interviewing, that ambivalence is really important. And a lot of what we do is we help to enhance the client's ambivalence or raise that ambivalence, let the client see it. But it's not done in a confrontational way. It's done in a way where the person they confront themselves almost with their own, they begin to recognize their own ambivalence about the behavior. And you'll see as we move into the session where Nanette's working with the older client that it's really critical for to be comfortable in motivational interviewing. You want to be comfortable letting the client sit with some of that ambivalence. And so you don't have to get closure on the session. We don't have to have the client say, oh yes, I'm going to change. It's really being comfortable enough with this approach to be able to feel that ambivalence and sometimes kind of letting it sit there. And with older adults, perhaps that may even be a little more difficult because we feel like it's important that they have certain information. We feel it's important that they change. We worry about, in particular with their drinking, maybe they'll fall. But we know research shows us again and again and again that just providing education, just providing information isn't always enough. And certainly the confrontational approach that has been so prevalent in substance abuse treatment, as you well know, Diana, you've written a lot about this in your book about the different approaches to treatment, and motivational interviewing is really, over the past maybe 15 years or so, has emerged as a very different way for dealing with substance abusing clients. And I think it's can be very useful with older adults in particular, where we don't want to be confronting them. We want to set an environment and a tone for them to feel comfortable when they're talking about their drinking or their other substance use.
And being comfortable with sort of leaving it where the client is at the end is, we often talk about it's like planting a seed. A lot of times the change that happens occurs after the session is over. And it's what's going on in the session. Wheels are turning, new ideas there. So you need to be comfortable with where that client is and accepting of it.
Yeah.
So it really sounds like it's a process. The client is coming to some self-realizations, and one of the roles of the treatment provider here is to also help them realize that they can change, or that you can build self-efficacy along the way in this process.
Exactly.
I like to think of the session as an opportunity. The counselor or the healthcare provider creates opportunities for the client to examine their roles, the discrepancy between their goals and their values and where they would like to go. So each session is an opportunity.
I like that phrase, opportunity for the client. Right.
Well, let's take a look at this session, and
Yes.
we'll discuss it at the end.
In the interview we're about to see, Nanette will be talking with Mrs. Cortez. Mrs. Cortez is 73 years old. She's Mexican-American. She has diabetes. She's been a widow for several years. And her children have become increasingly concerned about her ability to care for herself. Mrs. Cortez was recently found on the floor of her home incoherent. She was taken to the hospital, and upon examination it was found that her blood sugar level was very high. In addition, her blood alcohol level was a concern. Now that Mrs. Cortez's acute health problems have been resolved, the social worker has been asked to come and talk with Mrs. Cortez about her alcohol use and to determine whether Mrs. Cortez might like to reduce or refrain from drinking.
Hello.
Nice to meet you. I'm Nanette Smith.
Nanette
Smith. I'm one of the social workers here at the clinic.
Okay.
And I understand you've talked with your doctor about your medications and a nutritionist.
Dr. Lopez.
Dr. Lopez. You like Dr. Lopez?
I do.
Yeah.
Nice man.
And you have diabetes. And the doctor mentioned that some test results indicated some concerns for him about alcohol use and asked that we visit today so that I can get an understanding of what concerns, if any, you might have.
He said that. I like him. He said that he had some worries.
Did he tell you what his worries were? What did he say?
No. Well, the food, the be careful of this and that.
Okay. So again, the diet, what you eat, the food, and how that relates to your diabetes. We'll talk about a number of things today. I may have some information, maybe have some advice, but I won't be trying to make you do anything different. Won't be trying to make you change. If you do any changing, it'll be up to you. But we'll talk a little bit about today, if that's okay, about, I think the doctor mentioned maybe some wine is something that you enjoy from time to time.
Well, un poquito. ¿Habla español?
Muy poquito.
Un poquito, a little this, a little in the afternoon with my neighbor, Teresa, but not much. Just, and I don't know. Is it bad? I don't know what to say.
So a lot of questions about this. Doesn't seem like much at all. You enjoy it with your neighbor, Teresa?
Oh, it's very sweet, very sweet. She's been so nice to me, I have not many people to talk to, and I found her, and I enjoy her.
She's a dear friend. Important.
Very,
in your life.
very, very, very important to me.
Would it be okay if we talked a few minutes to help me understand about kind of how your day goes? And let's talk a little bit about the wine. For example, from the time you wake up in the morning till noon, tell me about how wine fits or not into that time for you.
Oh, I don't have wine in the morning.
Okay.
No, I get up and I pray and say my novenas, and I most days go outside and water my pots and kind of, I don't know, move things around, clean up a little, have a little toast or something. Not much. I'm not very hungry in the morning. And
So not hungry, but a number of chores, taking care of your flowers,
Wash.
the pots.
I wash. I don't have so much washing like I used to with my kids, but I wash if I need to. Go down and do that, and
you start the day with your prayers. With your faith.
Yes, yes.
It's an important part of
My
your
whole
life.
my whole life, yes.
Your whole life centers around that.
My whole life, I pray all the time.
And then from noon till supper time?
Well, noon, maybe a little before, I've got my stories, my novellas. Do you watch?
Sometime.
My stories and follow those, and then maybe a little nap.
So the afternoon's kind of a peaceful time for you.
Well, pues sí,
Some
un
TV
poquito.
shows, your novellas, and a
Quiet,
nap.
very quiet,
And then in the evening, when you move into the evening, what's your day like?
I go to bed very early, and so maybe, I don't know, 3 or 4, I go take a little walk and go see how Teresa's feeling, how she's doing. She's had trouble too. She's had a hip thing. She got a new hip thing, and so she's home and I'm home, and so we spend some time, sit down sometimes on her porch or in her kitchen and visit. We visit.
You visit. That's kind of part of your routine, part of your day that you look forward to.
The lately it has been. She's new to the neighborhood, but I like her very much.
And from what the doctor said, I think what you told the social worker too, that's when you have your little bit of wine with
Little
Teresa.
bit,
Okay.
un poquito, maybe. She says it's okay, and we just have a little, and we talk, and even laugh.
You have a good time with her. You enjoy your time with her very much. Sounds like one of the good things about the wine for you is that it's associated, it's part of your time with Teresa.
I love Teresa.
What are some other good things about the wine for you?
The wine. I don't know. I didn't even like the way it tasted first time, but it's not so bad. And I don't know. It just we laugh and relax a little, and that's it. Visit.
Helps you relax. It's kind of fun. Have fun with Teresa. What concerns, if any, do you have about the wine?
Concerns about the wine?
What are some of the not so good things,
I
if
don't
any?
know. Except for the doctor and that lady in the hospital. I mean, I didn't know there's anything bad. I don't know. Maybe bad for my diabetes. Maybe bad for falling. I don't know. I don't know.
So when you went to the hospital, this was not something that concerned you. Sounds like since then maybe something with the diabetes, maybe about falling.
Maybe. I don't know. It's new. I hadn't heard before. Do my children know this?
I'll check with the social worker. I haven't met with your children yet.
I don't know. I'm worried that if they're worried, I don't want them to worry. I don't want them to worry. Dolores is always calling me, and my boys calling and checking, and I'm trying to take care of her. I'm trying to be okay. I don't want to be a burden.
You don't want to be a burden.
I don't want to be a burden,
children.
and I don't want them to worry. I'm doing the best that I can.
You're working as hard.
I'm doing the best I can, and maybe I should do more. I don't know. Should I do more?
So your children are top of your life.
My children, they're everything.
Full of your heart. And you're wondering if you ought to do more.
Should I do more? I don't want to get sick. I don't want to cause a problem for anybody.
Especially your children.
What do you think I should do?
Well, your doctor has recommended that you change your use of wine. And his recommendation is perhaps you would consider not using wine at all, not drinking.
Well, not having any wine is fine, I think. I don't know. I just don't want Teresa to feel anything about me. I don't want to offend. She's a friend. She's a friend.
So one of the concerns of not using wine, not drinking, would be how it would affect your friendship with Teresa. if it would hurt her.
Hurt her, bother her, I don't know. And she's so sweet to me, and I feel fine when I'm there and afterwards, so I just don't know.
Sounds like there's a lot of puzzlement, a lot of uncertainty for you.
I sleep good and all of that.
So, on the one hand, Wine with Teresa is fun. You look forward to seeing her in the evening. She's a dear friend. On the other hand, concern about your children not being a burden, and some concern about the diabetes and maybe falling. Would it be okay if I wrote this down on a piece of paper so we could look at it?
Okay.
Sometimes we call this kind of a balance, and if we talk about some of the good things about wine for you, would be it's fun with Teresa. What else? What are some of the other good things?
About the wine? I don't taste okay, maybe.
Okay, taste. Not bad to taste. And some of the not so good things you mentioned to me, not wanting to be a burden, diabetes, I believe you said, and how it might be affecting. What were some of the other not so good things about wine?
Well, the doctor doesn't want me to.
Oh, that's right. The doctor has recommended that you not drink. So doctors' concerns, worries. Anything else?
Don't want to get sick, I guess. The sick and
Don't want to get sick. I think you said a while ago, it was interesting, you said, what do I need to do? What do I need to do? When you begin to think about making a change in your use of wine, and that would be maybe not drinking wine anymore, and considering how important that might be to you. And here's a ruler that we sometimes show people on a scale of 1 to 10. 10 means it would be very important not to drink any more wine.
important from the doctor
For you.
for me.
This is sort of in your heart today when you think about where you are in terms of 10 being very important not to drink wine at all. 1, not important. Where might you put yourself? You could even point on this line. Where might you put yourself?
Important not to drink the wine?
Mm-hmm.
Well, I guess, so I don't get sick, maybe somewhere over here.
Sound like maybe a 7 or an 8 over here. That's pretty high. What makes it so important as you think about it?
The sick, I don't want to get sick. I don't want my kids to worry.
Couple of things. Then your health, you don't want to be sick. And on top of that, your children. Not to worry your children or burden them.
They have so many things going on. They don't need me to have anything happening. They've got lots of things going on with their kids and their jobs and their this and their that.
I'm curious, Mrs. Cortez, if you decided not to drink wine anymore, how might things be better?
If I didn't drink wine anymore with Teresa, and that's the only time I drink it.
Only with Teresa.
Well, if the doctor says so or you say so and I don't get sick anymore, I don't go to the hospital, that would be, I think, what I should do.
So staying out of the hospital and perhaps not being sick anymore. Yeah. When you think about how able you think you are, if you decided today not to drink alcohol anymore, and we can use the same ruler if you like. There's a 1. I don't feel like I can not drink at all. 10. I'm sure if I make up my mind, I can stop drinking wine. Sometimes we call this confidence. With 10 feeling like I'm sure I can do it. 1 feeling like I don't think I can do it. Where would you put yourself right here?
So can I not drink wine with Teresa? Is that what you're asking?
The question would be if you decided, if you choose today not to drink wine anymore. It sounds like that would be with Teresa. How much do you feel like you could actually do that?
Well,
On that
very,
scale of 1 to 10.
very careful. I don't want to hurt her. I don't want to hurt her, but maybe I could think of something somewhere in here to figure it out.
Somewhere in here, kind of in the middle, maybe a 5 or so. Her friendship is important, and you don't want to hurt her.
But I don't want my kids. My kids are more important, so I don't
It's
know.
kind of that balancing
I'm trying
act.
as hard as I can. I don't know. She's around every day, and they're not, so.
So she's there for you. She's a friend for you. She's close by. And at the same time, your children.
My boys, my 2 girls.
Your boys and your girls you love very much, and you don't want to burden. One of the things we might talk about, if it would be okay, perhaps next time we meet, you said you might have to find a way in here of how to have your friendship with Teresa without wine. We can talk about that if that's something that would be interesting to you.
Okay, so I can think about it. Lots to think about. Boy, since I got home from the hospital, lots to think about.
Lots going on.
A lot going on. Got some new pills they want me to take. I don't like pills. And eat this, don't eat that, don't do this, don't do that. They want me to walk around more, and I think I walk a lot. It's a lot to think about, and now not do my special time with Teresa. It's a lot to think about.
They're asking you to do a lot, so many changes.
A lot to remember.
How you eat, how you exercise, medication maybe, and now even Teresa, or wine more particularly. Yeah, it's kind of confusing.
Well, I try not to be confused. I know my kids, they worry. I'm trying to remember everything.
As I sort of think about what we've talked about today, Mrs. Cortez, if I could kind of put it in a bundle for you, the hospitalization was kind of a surprise to you. And after that, your doctor expressed some concern, and now people are asking you to do a lot of different things. Start taking medication, maybe change your diet, and now this thing about wine. When you think about it, you said some of the good things. It was kind of fun, something to look forward to with your friend Teresa, just a little bit with Teresa. The taste was okay. Some of the not so good things, that concern about not wanting to be a burden, not going back to the hospital, diabetes, and the doctor asking you not to drink.
Do you have Teresa on here?
Let's put her on there. She is an important, the fun with Teresa, what you look forward to.
We laugh.
You laugh. Sort of, you said a while ago you have these 2 things. You have your children, your health on the one side, and Teresa on the other. Yeah. When you think about where you are right now, our time is nearly up, but if we use this same ruler on a scale of 1 to 10, and this time the question is, when you think about stopping,
You have lots of rulers.
I have lots of rulers. These are all I have, only 3. Think about stopping your use of drinking wine. How ready are you to make that change? 10 being, I'm really ready to do something different. 1, I'm not ready at all to change.
Ready to, like up here, think of something to do?
This is how much you think you can actually do it. The ruler here that we're talking about is if I'm going to think about this coming week, for example, and not have any alcohol, not have any wine at all, how ready am I to do that?
Is that what I should do? Not have any?
It's a real question. Your doctor is strongly suggesting that you not have any. Of course, the decision is up to you.
Well, if he says, you say, everybody's saying, I'll do my best. I'm trying my best. I'm trying. I'll do my best. Whatever you say. Where do you think I should be?
Well, it's hard for me to know for you. It sounds like you're kind of at a turning point right now. Kind of at a turning point. On the one hand, the time with Teresa is very important, The alcohol's been fun. The wine has been fun with Teresa. On the other
Time
hand,
for the fun to be done.
time for the fun to be done. You would miss that.
I haven't had any fun since Pedro died.
Yeah. And this is the
Ay,
one.
Dios mío. Wow. I'll try hard. I'll do whatever.
And this is the one bright spot for you. You know, we talked about, and again, I don't know if it would fit for you, but the next time we talk, ways to maybe think about some ways to keep that friendship with Teresa. And at the same time, meet your goal of being healthier, not being a burden to your children, maybe staying
How
out
to
of
still
the
be
hospital
friends with Teresa?
without the wine.
Hmm.
Yeah.
Well, I'm thinking if we can do that, that'd be good.
Well, I appreciate you coming, and it sounds like there's a lot of thinking going on up there. And when we meet next time, if you like, we can talk about the next steps you might want to take.
I like talking to you, though.
I enjoy talking
Somebody
with
to
you
talk
as
to.
well. Thank you for being here.
Oh, you're welcome. You're a sweetie.
Let's talk a little bit about this interview. Mary, maybe you'd like to start. Tell us a little bit about the motivational interviewing strategies that you saw most prominently displayed in this interview.
Okay. Well, I think Nanette did a very nice job of demonstrating, all of the MI skills, motivational interviewing skills and strategies. She starts a session with an open question. She asks Mrs. Cortez, what worries does your doctor have about your drinking? She talks just a little bit about the reason for Mrs. Cortez being there and assures her that she's not going to change her. She won't be telling her what to do. And then she moves into the open question and then very quickly gets a sense of Mrs. Cortez and her drinking by asking her about a typical day, which is a very nice strategy for learning about a client in a very non-threatening way. And particularly with an older person like Mrs. Cortez, she seemed to very easily move into telling Nanette about her watering her flowers and then her taking her nap in her morning. And Nanette was quickly able to determine a lot about her drinking. She didn't drink until the afternoon after her nap and with her friend, Teresa. And she also used a lot of opportunities there to reflect what Mrs. Cortez was saying. So there were some nice, very simple reflections in the beginning. Lots of open questions. Moved into, certainly you could see the decisional balance. Asked Mrs. Cortez, what are some of the good things about your drinking? And what are some of the not so good things? And it quickly became evident that it was the friendship with Teresa, the socializing, that her husband, Pedro, had been dead for, I guess she said, about 5 years. And so Nanette, very quickly began to explore the issue of the friendship, but again in a very open, very relaxed, very natural way. And she started with the good things and then moved into the not so good things. And in that way, she really developed, I think, a nice rapport, a trust very quickly with Mrs. Cortez. Determined that it was she liked the social aspect. The drinking did help her sleep. She mentioned that. And then the not so good things. Clearly her concerns about her health, her concerns about her children. And the children, that was the part that Nanette really elicited a lot of Mrs. Cortez's concerns about being a burden on her children, not wanting her diabetes to worsen, not wanting her health to get bad. She didn't want to get sick. Moved into then talking about the doctor's recommendation about her alcohol use. And again, didn't accuse her of anything, didn't, confront her, wasn't negative, and just listened very carefully. And then asked her, if you decided to make a change in your drinking, how would things be better? And how was that when you said that? What?
Well, and it was... It was a genuine interest in how things would be better for her. I wasn't sure at all what would be important to her. Had really limited expectations about that. So to hear for her how things would be better was an important piece. It's, again, back to that eliciting from the client what her goals are and in which way she'd like her life to be better.
Yeah. And then you really moved then into the friendship with Teresa, again, in a very natural way, and began to explore what it might be like if she had that friendship but wasn't drinking.
That seemed to be the key for Mrs. Cortez, and it was interesting in a fairly short amount of time with the decisional balance and the typical day first. You grasp so much information that is really vital to any changes that may happen for Mrs. Cortez in I'll use the word again, richer way than closed questions would have been. So it became clear that the two elements were the children and not being a burden to the children, and then maintaining this friendship in a way that was healthy and positive for Mrs. Cortez.
Yes, it was so clear that those were so important to her, and you did a very nice job of recognizing how she felt about the importance of her children and her friendship with her friend in the interview.
You know, through the open questions, you know, I gained that information. It was what she told me about herself. It wasn't, again, my presuming that I knew, but she provided the information that was going to end up being helpful for her.
What kind of change talk did you hear, Nanette, did you notice as you were working with her?
Well, one of the challenges, I think, was some of the confusion and uncertainty that Mrs. Cortez expressed. So by using open questions and, again, really the decisional balance, you began to hear what her concerns were. This not being a burden was a huge concern, not wanting to go back to the hospital. And at the same time, the change talk was, how can I have that friendship with Teresa? And Mrs. Cortez said this herself, maybe I'd have to look at another way to do this, to maintain that friendship.
Yeah, that was, she very sort of naturally began talking about the change, but then you could see that ambivalence in there as well. Teresa's friendship was important. She didn't want to give that up. She didn't want to offend her, and at the same time began to realize the importance, perhaps, of changing her drinking. I thought you did a beautiful summary at the end. You brought in the fact that the hospital was a surprise for her, and that she learned a lot of things. She learned about her diabetes. People were asking her to do different things, change a lot of things.
Many
her
different
diet,
things, right?
her diet, and then her drinking on top of everything else, and reflected, I thought, very nicely. Again, her the ambivalence and you know, your understanding that these behavior changes were oftentimes, use the word confusing, and yet you know, that it was important for her because of her health and not wanting to burden her kids.
And the use of a summary like that, another use is almost clarification for the client, clarification of what she had told me, but especially someone who is older and may have some challenges about pulling it all together. A summary can kind of pull out and put together almost in a graphic way and give some structure and focus to the session that can be very helpful.
You also used some scaling rulers in the session. You started with importance, and tell us about why you used those.
Well, it was helpful to me to really, again, gain more useful information about Mrs. Cortez and where she was in terms of what her feeling was about the importance of changing this behavior that had become something of a habit. We also use that sort of exercise, the ruler, as a way of eliciting change talk.
Yeah.
When I asked Mrs. Cortez why she was at a certain level and not at a lower level in terms of importance, what she told me was change talk. It was why it was more important to do some changing. And the confidence ruler, one of the things I did with that was to use the word confidence, but I also used other words.
Able.
How able do you feel? And again, I think that's important with working with people from a variety of backgrounds to be sure that there's an understanding of the concepts we're talking about. And that was also important information to have. Sometimes a person feels that it's highly important to change, but their confidence is pretty shaky. And that's helpful for the clinician or the counselor to have that information.
Yeah, I oftentimes people will ask us about the rulers and say, Are they useful for people perhaps who are duly diagnosed with a mental illness or have some cognitive impairment or an older person? And Mrs. Cortez didn't seem to have much trouble with the rulers. Again and again and again, people will ask that question. And we've done studies with people very low literacy, people from a number of different cultures. In fact, we've used this approach, as have many others, in many countries, lots of different cultures, and with people of all ages. And, clearly if someone had a severe cognitive impairment, you might want to not be putting numbers in front of them. But typically, if you show them a ruler and ask them to point to a place on the ruler, people can tend to easily do that. Has that been your experience?
It's been my experience, and I think at times what I did with Mrs. Cortez was I drew the ruler.
Yeah.
Had it on paper. Other times it can be done verbally. Different times, on a scale of 1 to 10, how important is it? But I think using that anchor can be very helpful. It's a very concrete way of considering importance and confidence and even readiness to change.
Right. And then at the end you used the readiness ruler. And by using that ruler, it seemed as though Nanette was able to get Mrs. Cortez just to kind of be thinking about the possibility of change. So again, she wasn't putting words in her mouth, but just kind of planting that seed, putting it out there. And then at one point she said, "Is that what I should do?" And your response to that was, again, I think you just asked her a question. You turned it back to her. So you didn't say, "Yes, I think you should change." But when Mrs. Cortez did that, asked that question, again, I think that was an example of beginning to hear, some talk about change. And I think that came as a result of your asking her the questions that were related to the ruler. And then again, summarizing at the end, sort of throughout that exercise, between the rulers, and then a major summary at the end.
I think, again, with a variety of clients, but the summaries throughout a session are probably very important. You don't want to over-summarize, certainly, but it's a way of gathering information and providing a little more focus, a little more direction, in some cases, to the session.
Yeah. And then there are some very specific scaling ruler questions that are open questions that then once you get the responses to those, the change talk, then you sort of pulled that together in kind of a bundle with your summary.
Yes, I saw clearly illustrated many of the OARS techniques that you were talking about earlier, the efficacy, decisional balance, so many of those things came so clearly through in the interview. Are there other comments you'd like to make before I ask you, Mary, if you could suggest a few major references for people who would like to follow up with this and learn more about motivational interviewing?
Okay. I don't think so. No other comments?
Just a thought. I think one of the challenges in a session is to maintain that empathic, interested listening and yet provide the session with structure and focus. Because motivational interviewing sessions are very focused on a particular behavior. So there were times when Mrs. Cortez, we could have gotten sidetracked into a lot of issues about her friend or not being a burden. Those were important issues, but not issues to have the session focus on entirely. So that tension of staying with the client and listening and being interested, but providing structure and focus to the session, which these skills and strategies really assist with.
And any major references that you would like to suggest to those viewing the video?
Well, certainly the primary source would be a book called Motivational Interviewing, Preparing People to Change by William Miller and Stephen Rolnick. There are another couple of very good books. One is called Health Behavior Change with, again, Steve Rolnick, Chris Butler, and Pip Mason. And then there's Motivational Interviewing in Healthcare. And then we have my colleagues, Kathy Crouch, Carlo Di Clemente, and Galen Maurer, and I have a book on substance abuse groups in substance abuse treatment using the stages of change approach. Those are all available, readily available.
In closing, I'd like to thank Kathy Armenta, Clinical Associate Professor at the School of Social Work at the University of Texas at Austin, who was nice enough to play Mrs. Cortez, our fictitious client in our interview today. Thanks again to Dr. Velasquez and Dr. Stevens, and also to Lucas Horton, Digital Media Services Manager, and his staff, and also Dr. Lynn Jones-Eaton, Associate Director of the Division of Instructional Innovation and Assessment at the University of Texas at Austin, for their help with this video. And most of all, thank you for watching and listening. If you'd like more information about assisting older adults, there are many more resources available at the website at which you are viewing this video.